So hi everyone, my name's Charnley. I'm the Director of the All Ireland Institute of Hospice and Palliative Care, which is to organise today's event, and I'm delighted to be chairing the day. It's lovely to see you all here today, and I'd like to thank you all very much for coming to the 8th All Ireland Annual Palliative Care Research Network Symposium on Out-of-Hours Palliative Care. We are very grateful to the HSC R&D Division for being a sponsor for this event and for the support of both the Health Research Board and the HSC R&D Division for the Palliative Care Research Network. We are also delighted that we have the Department of Health from the Republic of Ireland and Northern Ireland open this year's symposium. So the Institute was established in 2010 with the aim of improving the experience of palliative care on the island of Ireland. We have 25 partners, including 8 hospices, 9 universities, 5 health and social care trusts, 2 charities and the Public Health Agency, and we're indebted for their continuing support of the Institute, and I can see a large number of colleagues in the audience from our partner organisations, and you're very welcome here today. In terms of our funding, we have a range of funding from research funders to funding from the HSC and the Public Health Agency, and also some European and the Irish Hospice Foundation. In terms of our 3 work programme areas, it's around and to me these are really our cross-cutting themes in which all the activities of the Institute fit under. So integrating palliative care, so the palliative care approach across the health and social care system, partnering with users, carers and communities, and continuing to support the development of specialist palliative care across the island. We see ourselves as the Palliative Sectors Institute with key role in brokering relations, both between our partners, the wider health system, and international and national networks. So we have a key role in bringing people together and encouraging collaboration on a wide range of programmes and initiatives. I'd like to think we're a small and beautiful team, as we've a number of the team work on a part-time basis as well. I'm not going to steal Joanne's thunder in terms of research. So research is, as is shown by this event, is one of the key areas of work for the Institute. But I'll let Joanne talk about that more later in the agenda. Service user, carer and community engagement. Our main vehicle for this is Voices for Care, which is our service user, carer, former carer and interested citizen group. Earlier in the year we refreshed the group, and we currently have 47 members from across the island. The Voices for Care engaged in the work of the Institute, our partners, our researchers, both with online communications and face-to-face meetings. We also, another way in which we engage with service users and carers is our palliative care experience videos. And we've had 3 years of funding from the Health Service Executive in the Republic, where we've videoed people's experiences of palliative care. And obviously we're very grateful to those who've taken part in those videos. And I would encourage people to use them as part of presentations and in education, because they're a great resource. They're on our palliative hub. In terms of education, we've rolled out four projects with Project Echo, which is telementoring. So we've had 3 projects focused on nursing homes within Dublin, 2 within the Dublin region and 1 within the Midwest region. We've also this year rolled out a project with community-based allied health professionals with OTs and physios. My colleague Kathy's at the back of the room if you'd like to know more about that, because she's more of an expert. She's waving there. We've also rolled out a project with Erasmus-funded EduPal, which is developing a palliative medicine undergraduate curriculum and supporting online and teaching resources. And they will be available later this year, and we'll be looking to see how we can further develop them for the island of Ireland. We have an education network which brings together universities, hospices and those involved in palliative education. We look to support undergraduate, postgraduate and continuing professional development through a range of initiatives, including looking at, say, postgrad social workers is one area we're looking at the moment, and developing online education. In terms of our work with policy, engaging with government departments and agencies, including the HSC and the Public Health Agency, around policy developments, supporting the clinical programmes in both jurisdictions, and looking to support the links between policy, practice, research and education so that they all feed into each other. Okay. In practice, we have a Chief Executive of the Hospices Network, in which we have 2 meetings a year, and we bring speakers. We have kind of speakers that come to those meetings to kind of prompt discussions. We're members of relevant national, all-island and international networks, and we look to host and support conferences and workshops throughout the year. And we're already in the planning stages for a number of workshops next year, which we'll be sharing in our newsletter, for example. The Palliative Hub is our online gateway to information and resources about palliative care. So with 2 public-facing sites, the Palliative Hub Adult and the Palliative Hub Children and Young People, that provide information for members of the public, so public-facing, with the learning platform, which has approximately 15 online learning programmes targeted at both the public and professionals, and with the Palliative Hub Professional, which has resources. So it has all the national guidelines on, it has resources for educators, researchers and professionals. And I would say, members of the Palliative Care Research Network, there's an area specifically for yourselves on there, and I would encourage you to look at that. And we have a separate site for carers as well. Raising awareness of palliative care. We're still recovering from the last week, but we'll be moving on next year for our 7th successive year of Palliative Care Week. Really, the week aims to build awareness and understanding of palliative care, but very much the Institute develops the materials in collaboration with our partners, but without the support and buy-in of both our partners and the wider sector, we wouldn't be able to make it what it's become. So we're continuing to grow every year. We also look to raise awareness of the Institute as well in our work through international conferences and the like. So that's just a brief overview of the Institute.